So many of you think that probably you could exercise and you could ward off a heart attack, supposedly. Now, certainly that will help maintain your weight. That means that for the amount of time you exercise, you could maybe eat that other Big McMuffin. But you know, look on the machine the next time you exercise and see how many calories you burn running for an hour. Now, a Big Mac is probably 800 calories. You'll be close if you run an hour. If you walk, you'll be walking 12 miles to burn up a Big Mac. So if you're thinking exercise will take care of your excess eating, you're just dreaming. It's not an ocean in Arizona. You know, this is not going to work. Now, if you want to get your weight down, you got to cut the calories. And that probably is the easiest done, cutting out snacks to me. I don't care how you cut it, you got to cut the calories. I only see people for a short time in the operating room. They ask me usually when they get off the table after you put a stent in their coronary artery, you know, what kind of bicycle should I buy? Forget the bicycle. Cut your plate in half. That will save your life. But, you know, they'll do it for 3 months and they come back and they're gaining weight again. So I think your body is attuned to eating these foods. And once you get into this, you're going to have to cut back. Will you be hungry? Of course you're going to be hungry. Don't surprise yourself and say, oh, I can change my diet and not be hungry. You're going to have a little hunger pain because you're trying to change your lifestyle. But that lifestyle change is probably 80% of my picture here. I can treat risk factors by numbers. I can lower your blood pressure. I can bring your cholesterol down. Can't change your genetics. The main thing here is those are great, but if you put them up against what can I do with lifestyle versus drugs, drugs don't account for just a whole lot. To bring your glucose down and you continue to eat everything under the sun is not going to save your life. It's going to make things worse because we'll just keep raising your doses or drugs to compensate for the glucose level. I'm not dealing in glucose. I'm dealing in keeping your heart running and keeping your vascular bed cleaned out. The best way to do that is to look healthy, act healthy, and eat healthy. All these things go together, and you can't just take one separate from the other. So if I had to say which is most important, could you be a big, heavy person and exercise all the time and actually do okay and not have risk factors for heart disease? No, I don't think so. I think that the same guy that exercises all the time, I put stents in, and he's heavy. But you know the guy I do not see on the operating room table very often is a skinny guy. They just don't come anymore. The skinny guys, by and large, on the little old ladies that are 95 years old, are the only ones that I see around. And you might ask yourself, why could that be? Diabetes patients, by and large, have this excess weight that carries a lot more risk than just average. The fat that's around your belly that makes you look like Santa Claus, that belly weight is atherogenic. It sends signals to the heart around each blood vessel in your body and has a crosstalk and actually tells that blood vessel to collect inflammatory cells, inflaming the entire blood vessel wall from one end of your head to all the way to your toe. So I want you to lose that weight. Now, do I have to worry about you going too far over the hill and just being too skinny? I don't think that will be the problem for most of you. I think we need to get the weight down. How much do you have to lose? You know, I'll take anything. Your body, when it starts to see the weight loss, it will fight you to the wall to eat that extra ice cream. It knows. Even me, and you think I'm skinny, but I'm not. I'm losing weight too. But I'll guarantee you that I also have to say to myself, I am hungry and I could eat that Big Mac, but I'm smart and I know that I don't want to get a heart attack or lose my leg or become blind or have kidney problems when I get to where I'm retiring and now I want to travel. So it's your choice. It's quality of life. I have lots of things to pick from in the operating room, but nothing I put in you will make you live any longer. Nothing. You can have bypass surgery. You may be just a little bit longer than the stent person in special cases, but nobody's going to beat a guy that lost a lot of weight and got skinny. That guy will beat everybody out there because he has now changed his entire makeup of his entire vascular tree. And we have that by intravascular ultrasound pictures. We go down the artery and look inside of it. And you can see in some people that actually that has regressed in some patients. Not everyone, because you came at a later time. If you had been young and someone had woke you up and said, hey, you're 25 years old and you're 40 pounds overweight, we need to get you going, we might have been able to make a difference. What diet you pick really makes no difference to me. I think you need to lose the weight and then exercise to maintain it.